um, the evaluation as she does following the series in the next day or two. Thank you for being here. It's been a little bit of time since we've gathered. We were on a good cadence and then had a couple of skipped weeks just for the sake of scheduling. So today is the seventh in our series on building strong foundations, early childhood mental health webinar series. And today we're going to be focusing on supporting fathers and grandland families in early childhood, which is certainly a topic, when coming up with, what should be covered in a 12 series sort of arc covering the field of infant and early childhood mental health is something that is very important to discuss and consider. So hopefully we'll have a dynamic discussion today, really with some grounding on, where is our efforts within early childhood and child serving settings with respect to sort of these two very important considerations for young kids. We've done a lot to kind of set the stage around adults being so important, and sort of the context of who and where kids are growing up with being so important for their own individual regulation and sort of skills that we consider with respect to infant and early childhood mental health. And today we're going to, talk specifically about, given that, how can we do a better job, both meeting and intentionally seeing the needs and supports and opportunities to partner with fathers in this space and grandland families in this space. So with that, we will get started with content. We're already recording. As I know some of you, as happens in this field and work, might have signed up for this because of the content or sort of the topic particular felt germane to your work, and then something happens that seems more urgent at the time. So this will be distributed for those that didn't make it today with us. And just a thank you to Haley and Randy and the whole Mental Health and Recovery Board of Union County team for hosting the series. It's such an important sort of topic and consideration, whether you're working directly with young families or having the opportunity to work with, siblings or caregivers in a different way. That just sort of knowing more about how the impact and opportunities to support the young kids in their lives as well is a really important part of this work, no matter what part of the lifespan we're all working within. So I appreciate the opportunity to spend 12 hours with you all on it over the course of this series here. We're now firmly in the second half of the series. So we started with the foundation. Webinar number 2, all the way back in February, focused on attachment and relationships. March, we talked about reframing behavior, so how to understand behavior of toddlers and preschoolers, which can feel hard to do in the moment, and some of the sort of thinking in the field around understanding and supporting challenging behavior, moments of behavior that challenge adults from very young kids. Webinar 4 focused on trauma and toxic stress. And then 5 was about reflective practice for adults. So given that sort of arc of information, how do we kind of really look at how the adults are doing and the opportunities to really support them, whether it's the clinicians, the educators, the family members that are working directly with young kids, to really see that as a foundation for any work moving forward. We gathered last month in April on Tax Day, it looks like, to discuss the considerations around caregiver mental health as it relates to mental health of very young kids. And then today we're talking about fathers and grandland families. And then we'll be back in short order on the 27th to talk about developmental considerations within very young kids, both sort of typical development and also considerations around neurodiversity, temperament, and developmental variation. Something that the more you get into this work, the more you realize that adults just don't always necessarily know that. And that's often where you see moments or periods or trends around conflict, is where there's developmental tasks that are beyond where a young child is at the time. We'll talk about relationships in early care settings in June. In July, we'll talk about observation and assessment in very early childhood, and some of the differentiation around clinical diagnoses at that time too. We'll talk in July, at the end of July, around early language and social development and the tie of those two. And again, hopefully with some concrete strategies and tools for you to fold into your work. And then regulation in early childhood will close us out in August. And by that time, we'll all be um, well thought out and tan and all those things. So that's the arc of our webinar series. And if you are joining us for the first time today, although I see many names that I've grown to know over our Zoom series, I am Kate Sweeney. I'm a clinical social worker by training and work as an assistant extension professor, meaning all my work is really external to the school on projects like this, really working to build systems and responses to early childhood mental health within states and regions and partnerships. And my clinical focus has been throughout the course of my career, really the perinatal to early childhood age. So this is a topic that I could talk about forever. Just to ground us in our goal for the next hour. So, as I said earlier, we're really focusing today on supporting fathers and grand-led families and early childhood services, and looking to first get a lay of the land. So, the objective, as you can see on the slide on the right, to describe the unique strengths and roles and experiences of fathers and grand-led families in supporting young children's development and well-being. There's some great studies that we know around just sort of the benefits of their involvement. To recognize common barriers and stressors that fathers and grandparents or grand-led families experience when engaging in early childhood programs and services, to consider how we can support inclusive relationship-based practices with those adults to foster dismantling some of the blocks for their engagement within, traditional services. And then to think about, how all of those strategies could apply to your work and your role within the field. Just by way of review, and this slide should seem familiar to you by now if you joined us for one of our previous webinars. We're going to sort of ground ourselves in these next two slides, just knowing that we're delving into one or technically two particular related topics today, but that all of this is really anchored around the infant and early childhood mental health principles that are really focused on relationships, really focus on sort of the considerations of development, and focus on strength-based and prevention-focused work. So how do we focus on, with the variability lens that comes into sort of the many ways that families and parenting happens within cultures and communities and languages and those sorts of things, really sort of anchor ourselves in this work that is seeing the strengths of those that come for support. And this, again, just by way of grounding us, is the definition of mental health within early childhood. And I'll just read it out loud for the sake of review. And this is considered sort of the nationally adopted definition, both from 0 to 3 and also the book that you see sourced here. It's the developing capacity within a child from birth to age 5 to do 3 things. So to form close relationships, to experience, tolerate, and express a range of emotions without lasting collapse. And the last part of that phrase is the one that's most important. So we want a range of emotions, and not just positive emotions, but the frustration, the boredom, all the things, and to have the expression of that and then the recovery of that, so without lasting collapse, and to explore the environment and learn. So with that in mind, wanting to start with a reflective prompt, and you guys have been talking it before, but I'm also happy to uh, read from the chat if that helps. But traditionally or typically, when we think about this little one in the picture here, we've talked a lot about the impact of his people on his well-being and how he's showing up within the classroom or clinical space that you're seeing him in. But who are the caregivers that we most often picture with when we think about young kids and talk about families in early childhood settings? Who feels visible and who feels overlooked? So I'll pause and invite you to, again, either unmute or type in the chat sort of what comes to mind as you see that prompt. So who are we considering dropping him off or part of our work with him. And thanks as always to some of you that have already jumped in. So Leah says visible mom, dad. Monica says moms and grandmas. Jennifer says mothers or female caregivers, teachers, grandmother, etc. seem to be more visible. Yeah, yep. Many of you are agreeing. Sort of the female role seems most traditional. In some ways, with gender, we've evolved a lot. In some ways, we haven't, right? And again, just the assumption is that we've sort of unintentionally been uh, explicit about moms and not about the other caregivers. So why this matters is that not only sort of inviting in to our work, wherever what that work is happening, whether it's within an educational space. Um, mm, Sarah, thanks. You're also considering like some older siblings if there's a large age gap, and they're sort of taking on a little bit more of a caregiving role as well. Um, but we've talked a lot, as I said, about no matter what part of the work you're in, whether it's you're seeing this family within a community space, within a clinical space, within an educational space, within their home. The we know that children are only as good as their people are, and that their sort of opportunity and to learn and to engage in all of the things that they do throughout their day is dynamically done with those people. And so in order to kind of not only really sort of fully engage them in the work, but also really fully assess their needs and where there might be linkages for supports, because often, early childhood programs are ports of entry for families that might need or indicate additional supports or services. We need to be more intentional about, again, inviting them and really assessing or asking about their needs as they come into work with us. So just a little bit more grounding or setting the stage before we get further into this. Wanting to sort of start with definitions. You guys probably all, as I um, as you sort of read the topic or sort of title for today, had your own internal sort of working assumptions or understanding of any of these two terms. So fatherhood or grandparent or grand-led families. And so wanting to just sort of ground us here. So the term fathers within the course of our hour will really be inclusive of biological fathers, adoptive fathers, foster fathers, kinship fathers, stepfathers, or chosen caregivers, right? So wanting to be intentionally inclusive and expansive on that term. So male caregivers that are sort of primary to a child. The term grand-led families was new to me fairly recently, I would say over the course of the past 5 years, and refers to grand families, also grandparent-led families. So any of those terminologies are defined as families in which grandparents or occasionally other adult relatives, close family friends, serve as the primary caregivers for children under 18. So raising them without parents present in the home. So it's a little bit different than a dual generation household in which family might be living within a multi-generations within the home and grandparents are present. Those are important to consider as well, but we're talking specifically here about how child-focused programs can be supportive um, of families where there's a skip generation or sort of the direct parents are not currently present in the home and the provider is the grandparent. So just again to ground us a bit. And knowing that, as I said before, this is just a visual from, just a random program assessment from a home visiting program, that a lot of our language around, mother baby units, mother infant home visiting programs, even some of the qualifiers for sort of home visiting or sort of supports are really maternal driven. And some of that is based on tradition that's evolved. Some of that is also based on the studies and science that we know that there are certain sort of maternal indicators for those services, since those, at least in our country, are not universal. But how some of that language kind of begins to disinvite fathers or non-maternal caregivers right away. So again, the idea of really how do we acknowledge that and try to work a bit to kind of undo that intentionally. I'm gonna try to hide this slide for now so that you can see the text here. So this is just a screenshot from 0 to 3, which is the National Advocacy and Center for Kids in Early Childhood, focusing on a range of things, developmental and mental health. But they talk a lot about fatherhood initiatives as key to this work. And I'll let you read the quote here, but I thought it was prominent again as we're trying to kind of pivot from where we know we are especially in early childhood, where it tends to be a lot of mom and baby work, or to language that is really inclusive of fatherhood. Um, and, they talk about dads are increasingly frustrated by being referred to as the babysitter when spending time with their own children. Fathers are often left out of parenting and early educational spaces, which is a problem because we know many positive outcomes for children and families when fathers are present and involved. With this in mind, how can we work to create environments that promote practices that engage and support fathers? So, again, just a quote to legitimize this effort within our own work. Um, so what we know about fatherhood as we start. So active fatherhood in early childhood is vital for child development, offering unique benefits that complement maternal care and drive improved cognitive, emotional, and social outcomes. So there's a range of studies from a range of places that really talk about when fathers are engaged with their child, and that can, but doesn't necessarily mean, a married couple living in the same household. But when fathers are regularly spending time interacting and supporting their child, there's benefits to child development that can be seen very early on. So some of the highlights are here. So children involved with caring fathers have stronger educational and developmental outcomes, often better linguistic and cognitive capabilities. Now, some of these studies, might ping a feminist nerve for you, possibly, because they look at sort of very traditional and sort of some assumptions around gender, but in general, they acknowledge that fathers and mothers of those genders can typically engage with kids differently, from language to how play happens to, sort of what their sort of time on sort of, if you think about the circle of security, right? So their time and responsiveness and those types of things. For some that can ring true, for some it doesn't, but a lot of these studies sort of cluster the genders in that way. But that when there's different sort of parenting styles, linguistic responses, et cetera, that benefits kids. So you see, that when they're sort of almost code switching, right? Or sort of understanding, and kids do this very early on. They understand that I can interact with grandmom or granddad or mom or dad differently. It helps the child sort of navigation of that grow. So their cognitive navigation, their displays of various language abilities is often marked as higher. They come into school with higher academic readiness often, and a lot of the sort of documents around fatherhood and play not only supports like gross motor development, but also regulation and behavior in general, so that their ability to navigate and regulate dynamics in play. A study out of Cambridge found that dads who actively play with their child, they were able to determine cognitive development increases by 22% within the first year of life. So a lot of this is, not just the like little t-ball or football, sort of when kids are at that developmental stage, but the impact of this is seen in very, very young babies also, with ties to higher academic achievement as well. So overall, big takeaway is that moms and dads or sort of genders can often typically, if we're allowing for these sort of broad categories, interact with kids differently, and that kids benefit from that, and it's seen in their development and academic achievement. Fathers benefit as well. So there's been some studies that look at long-term benefits for dads, indicating that men who maintain active and caring relationships with their young children often experience improved health and well-being outcomes for themselves. So again, like both parties benefit from this dynamic, which you can know in your heart, but it's always lovely when some university legitimizes that with an academic study as well. Um, but so we know the importance and the impact of young kids or for young children when their fathers or father figures are routinely involved in their world. And we know, as we said earlier, that a lot of the traditional ways that, especially very, baby and early childhood programs have been set up, where it's not very inclusive of dads. And so what you'll see in the next couple of slides is what we know about that. So there's systemic social and emotional challenges for participating in early childhood services. So the structural barriers are, that fathers often have more rigid work schedules that, don't allow for the flexibility of daytime school events or meetings or services. Limited parental leave. So, we've advocated for family medical leave, but most often that's unless any of us are lucky enough to work in some of the Silicon Valley spaces that are offering both parents a year off after having a baby. It can be very limited whether you're gendered, but most often only really fully engaged in by a female who was delivered a baby. And so often, not only for the sort of that initial like bonding period and sort of caregiving period, that the sort of structure of paid family leave is not offered to fathers, but also there's a lot of navigation of, initial childcare planning. There's many visits to the well child or sort of the pediatrician or family provider at that time. And so you see just like a bifurcation of some of the restraints around workplace in fathers engaging in just sort of these relationships and those schedules early on. And then just a financial strain can often be seen. I needing to prioritize immediate economic needs over, stepping into the classroom or sort of volunteering and stepping into some of those spaces, attending, some of the library, like toddler circle time things that are often, at 11 a.m. or 2 p.m. Thinking a bit about institutional or systemic biases that block fatherhood involvement. So often these are female-centric spaces. So there are, definite, trends in the people that have roles, especially within early education environments. But many sort of early childhood spaces, it's often, female staffed or guided by female professionals. And that can be a hard space for non-female caregivers to step into. Sometimes, again, we're doing our best to sort of begin to sort of walk this back, but some of the language around how these groups or sort of celebrations or offerings are named don't explicitly name dads, and that's super important to do. And some biases or sort of staff attitudes around fathers can come up in this work as well. So knowing that those can be both like logistical and interpersonal barriers to fathers stepping into these spaces. We're going to talk now about some of the strategies to support fatherhood engagement. If this is something that you're further interested in, I'm happy to sort of send some of the guiding resources around this. Head Start is a space that the National Center for Head Start is a space that they've done a lot of work on this. And a lot of these things, again, are sort of very logical, but have to be intentional, just like a lot of this work. So if we think about inclusive environment and representation, the same way that we think about, being inclusive of race and sort of different family presentation for kids, we need to think about that for their adults as well. So when we're thinking about posters, flyers, pictures, are we being intentional about having fathers or, male parental figures illustrated in that, in our offerings, whatever, part of the work you're in. Um, Same with like literature, right? So that we're ensuring that within the classroom or clinic spaces that there are materials like whatever they're interacting with. So if it's a workbook that they use within a group session with you, if it's just sort of materials in the waiting room or the clinic space that they're using with their kid as they're waiting for their time with you to start, or if it's within a classroom setting, how are we ensuring that, again, dads are showing up in those pages? And then providing concrete architectural welcomes, like something as simple as installing baby changing tables in male restrooms as well. So not only assuming that that's the task of the female caregivers. A couple of other sort of like clusters of sort of strategies around supporting fatherhood engagement you'll see here. So dual parent communication and outreach. Again, this is done if, within your intake, there's two parents or two caregivers identified, making sure that you're not defaulting to one. That can sound very logical, but you'd be surprised how often schools and medical offices and clinical spaces really do tend to default to one parent. And even if the other parent, or so the male caregiver has never come to the space, the importance of having just sort of dual communication and outreach universally. So you can see a couple of like the logistical ways to accomplish that here. But on the intake paperwork, so modifying official center documents to provide separate, distinct signing lines for both mothers and fathers, or multiple caregivers, to implement dual contact rules. So calling both parents if they're listed individually when scheduling family teacher conferences or reporting student illnesses or, sharing updates around their child. Doing the same for digital updates. So a lot of programs will use, text to confirm appointments, or if it's a childcare setting, or an educational setting, like we'll use some of the apps to kind of update on like how things are going or sort of videos. And so again, being intentional about ensuring that that's going to multiple caregivers if there's multiple caregivers involved in the child's life. And that, like we're being intentional about, including so not having muffins of moms, right? But including fatherhood or sort of caregivers or parents or family in the language. And then the third sort of, when you look at the national sort of guidance here, the third sort of bucket of strategies to support fatherhood engagement in early childhood spaces is really around, how are we designing sort of events that with sort of flexibility and intention around inclusion of multiple caregivers. So scheduling around shifts, so hosting conferences and orientation meetings during various times. And sort of not having it just fit, a rigid work schedule or offering, prioritize action over meetings. So, trying to sort of have hands-on opportunities or invitations for, multiple caregivers to connect within the space that you're working with the child within. So whether it's within a clinical setting or an educational setting, targeting transition windows to kind of, again, really intentionally engage fathers if they're involved. So focusing on outreach heavily in the first year of school enrollment, so that it's not just a one-time opportunity to, sign up or consent or whatever it might be. And then another opportunity here is if you're running a group or having something that is an offering, the opportunity to have a father focus programming as well. So how are we, kind of picking up and sort of supporting them to be in that space and to have access to that content as well. So with all that in mind, wanting to think a little bit about grand-led families as well, and wanting to give you a bit of background here as some of this has adjusted a bit. But more than 2.5 million grandparents in the US undertake their primary responsibility for caring for their grandchildren to meet their basic needs. For some, this can be a temporary situation, and for others, this is due to their families' circumstances, something that is more permanent. And we'll talk about that a little bit. These are families that are headed by a custodial grandparent, often called grand families or grand-led families, are among the most common form of kinship families, with relatives taking responsibility for raising children born within the family, and that these families not only need to be seen in our spaces for young children, so the same trend that we had in talking about fathers, but often have some very specific needs and supports that we need to be intentional about assessing and connecting based on the way in which a lot of children come into their care. And we'll give you some more information on that as well. But in general, there's a growing trend here. So there's more states have, and sort of family or child welfare courts um, have pivoted in the past decade to a preference for kinship, so that the preference is to, even if it's out of state or any of those types of things, to support children to be with a family member if they're available versus going into to child welfare or that situation. And so that's one of the drivers of seeing more numbers here. These numbers also really spiked during COVID because there was caregiver loss. And so that necessitated grand families to step up if they were available. And also increased, or just the impact of substance use disorder has been a driver to increase this trend as well. So not only with respect to parental loss, if that's a circumstance, or parental inability, so substance use driving, that either the caregiver losing custody through the child welfare system, or having temporary removal from the child's life due to incarceration around substance use, or not being an active member, either due to sort of the space that they're in within their addiction, or their actual loss. There's been a lot of those have been driven to increase the number of grand-led families as well. So that's sort of all the context that we're seeing this in. And we know that for a lot of those reasons, again, it's not just about seeing them and inviting them into spaces, but it's how do we, within the family serving and sort of mental health space, really understand their unique needs. One of which is certainly financial. This video does a great job, and you'll see a couple of grand families in this, really just sharing sort of the urgency of the scenarios in which their grandchildren came into their care, and the financial strain that had as well. So I'll play this for you now, and we can reflect on it once it's done.
Hi, I'm Trishawn Anderson. In this video, we'll focus on the financial issues families face when taking on the care of grandchildren or other kin. Kin caregivers, like the grand voices featured in this video, say that the shift in roles from supportive grandparent to full-time parent often happens with no opportunity for planning.
I was actually employed, and I had a nice, comfortable job just for myself and my little one-bedroom apartment. And all of a sudden, I get a call at 2 o'clock in the morning saying that the kids have been picked up and they're actually in foster care, and to come and get them if we could. To undertake 3 children immediately at 2 o'clock in the morning is probably the most trying thing, because at this point, with a one-bedroom apartment, where do you put them? You put them on the couch, or put them in your bed with you, or whatever you need to do.
Kin caregivers scramble to address children's immediate needs like food, housing, medical care, and other expenses, from diapers to school supplies. Some kin caring for children in foster care get monthly stipends, but most grand families are left to their own devices.
in a time when you're ready to retire and you've got your life savings there, you're all of a sudden taking care of children. The parents were court ordered to pay child support, which didn't ever come in. And, it wasn't about the money for us, but it has been expensive. There's no doubt about it.
So there's a wealth of knowledge out there, and all people have to do is find the right person or the right agency to be able to feel comfortable. And it starts with, asking.
You can help grandfamilies navigate the options by knowing what supports exist in your area and providing a warm handoff to these programs. You'll find suggestions here and in the print materials that accompany this video. Let's talk about the 4 areas where families frequently need help and how each can be addressed. First, there's food. There are 2 federal programs that provide food benefits to low-income families, WIC and SNAP. WIC, also known as Women, Infants, and Children, provides food to women during pregnancy and after their child is born, and to children up to the age of 5. Children in the care of kin caregivers are eligible for this support, and the caregivers do not need legal custody of the children. Grandfamilies without legal relationships can also access SNAP, the Supplemental Nutrition Assistance Program, sometimes called food stamps, which loads money onto a debit card for the purchase of food. A grandfamily's income and the number of people in the household determine the amount of assistance. It's important to know that SNAP does not cover essential non-food items like diapers or laundry detergent. It's also important to know that families who do not meet the income requirements for SNAP may still struggle with the high costs of groceries. But there may be community initiatives available to help fill that gap. Next is housing. Making room for new family members can be one of the most difficult problems for grandfamilies to solve. Younger kin caregivers with children of their own may have little space to spare, and older kin caregivers may have downsized in anticipation of retirement. Grandfamilies may face housing restrictions as well. Those living in retirement communities or government-subsidized housing may suddenly find themselves in violation of limits concerning the ages or number of people living with them. Social service agencies may also have requirements concerning separate bedrooms for children.
That circus didn't even start rolling until they told me that I had to get a bigger house or bigger home with at least 2 to 3 bedrooms within 2 weeks. Because if I didn't do it in 2 weeks, then the kids would go back into foster care. Financially, I was sort of okay. I mean, I could afford a 2-bedroom apartment, but it was how do you find one? Then you have to get, the security deposits and other things going on. I don't think anyone can formally try to get that together, especially when you're just saying, all in the back of my thought was that my grandkids are going to be taken away. If I can't find a home for them big enough, they're going to take them away.
For low-income families, the search for housing can be even more difficult. Families can apply for a voucher for subsidized housing, also known as Section 8, through their local public housing authority. But demand is often high, the wait list can be long, and the landlords willing to accept vouchers are in short supply. It's important to know what's available where you live so you can offer the best suggestions for short and long-term housing options. These might include organizations that provide emergency housing assistance, local realtors, the Public Housing Authority, and occasionally communities designed for intergenerational living. Healthcare takes a big bite out of most family incomes. For kin caregivers suddenly responsible for children, it could be a huge, unanticipated expense. The good news is that there are 2 federal programs that provide free or low-cost health insurance to children, Medicaid and CHIP, the Children's Health Insurance Program. These programs are administered by individual states, sometimes under different names or combined as one program. The rules vary from state to state as well, but in general, these programs support grandfamilies in the following ways. Every state allows grandparents and other kin caregivers to apply. States do not require legal custody or guardianship, and most states do not consider a kin caregiver's income and assets in determining if a child is eligible. This often changes once a child is adopted. Many grandfamilies don't access federal health insurance programs because they don't know that they qualify. You can call 1-877-KIDS-NOW to connect families with the help they need. We've described grandfamilies' food, housing, and healthcare needs, but there are many expenses not included in those categories, like diapers, school supplies, braces, or cars with room for an expanded family.
We came to a point where we needed a vehicle that could transport 9 people. So we actually tapped into our 401 to get a vehicle that would accommodate us. And that was a little scary because we were planning for our retirement, but we also knew that we had to do what we needed to do to take care of the kids. And so we did what we had to do.
Now we have 3 kids who need beds with the bedding and et cetera, things that go along with it. Then also you need other additional things, food, you need hairbrushes, you need toothbrushes, and it just, the list continues on to the point where you're thinking, where's this going to stop and who's going to help me?
One financial support available to all grandfamilies is TANF, which stands for Temporary Assistance for Needy Families. As the name suggests, it's a program intended to help low-income families. If a grandfamily's income is too high to qualify for TANF, it's possible to apply for child-only TANF, which considers the child's income separately from their grandfamily's income. And TANF is sometimes available for emergency purchases like a crib. The financial impact of raising a child is staggering. We can support grandfamilies and kin caregivers with the information and referrals they need to make this transition a little less difficult and help them focus on what's important, caring for the children who need them now more than ever. For more information, see these resources.
So on the screen here, you see Generations United on the left, and that is one of the leading national advocacy organizations for grand-led families and just the various needs of multiple generational families. But they've done a lot of work to really elevate the need here. And I had the opportunity to work with Miss Gray, who was one of the last caregivers that was in the video who talked about needing a car for 9 and needing to dip into her 401k. She was featured in a learning community that we did for SAMHSA now many years back, pre-COVID. And she was talking about her work. She started something called Gray Nickel after her last name to really run an advocacy. At that point, it was specifically for grand-led families in Arizona, the state that she was in. And she was sharing that grand families, because they're under the category of kinship care and not legal foster care, received like less than half of the financial stipend that foster care homes did to meet the needs of the same exact kids. And so it was this tension of knowing that children are often so better served within their family homes when they're in this situation, and they're financially getting less support for those things like diapers, emergency needs, beds, things like that. So she was able to launch a full advocacy campaign and had that issue addressed at the state level in Arizona. She's a wonderful advocate. We were able to have some more work done specifically with her family and recorded, I think, something like 19 hours with them over the course of a year that we turned into a podcast called Circle of Love that features her family. So there's she and her husband, one of her close advocates within the Arizona State Senate is on there, who helped pass the legislation to course correct the amount of funds that a kinship family or grand-led family gets from the state when a child is placed with them to support with the basic needs. Yeah, it's so happy to share the link to this. I think there's 8 different sessions, and we sort of go through the whole thing. But one of the just their family story and um, uh, the considerations both from their family's perspective, but also the system's perspective on how we can do a better job meeting the needs of grand-led families and children within kinship care throughout our country. So I'm happy to send the link there. And as you could tell from just her short video clip, she's such an advocate and just a so dear, precious person. So it was an honor to get to know her and her family through this work and to share the story. But so not only did she really shine the light on the disparities that families are supported within the system, there's 2 other sort of considerations around grand-led families that she really highlighted that I think what is not has not been publicly discussed enough with respect to how we in the sort of mental health field can better meet their needs and support them to be successful with their children. And the first is that all of those things that, all of the various social supports that were discussed in that past video take time. And all of the sort of appropriate legal paperwork and those sorts of things. And often that doesn't come online until like a month after a child has been placed into care. So the reality is that within the first, 2, 3, 4 weeks of children being in care, there's a lot of out-of-pocket stress and expenses around, as you heard, sort of bedding, required pediatric visits, sort of all of those things, often clothing, often, school supplies and all of that. So that there's a gap in like how the system is set up and structured to support them. And then the other thing that she really highlighted through her family story that you'll hear discussed a lot in the Circle of Love podcast if you take a listen, is just the context of multi-generational sort of family trauma that is the reality of the circumstances that these families are in the moment that they come into this care, right? And so that can sometimes be as the one of the grandparents shared in the video, a call to pick up kids at 2 in the morning, and some of it is uncovering sort of some of the circumstances that led to them coming into care. Some of it is sort of the sort of tragic or acute loss of a caregiver, either due to incarceration or due to them being deceased, and sort of the multi layers of not only financial and systemic support that they need, but what that the sort of types of sort of parental caregiving coaching and guidance that is needed for them, and the various layers of their own mental health supports that are indicated. Kids that are coming into a multi-generational household after perhaps being very parentified. One of her grandsons talked on one of the podcast episodes about, he was really the caregiver for his younger siblings, and then all of a sudden they were in a home where there were, 2 grandparents that were trying to set routines and schedules and rules, and that it took him a while to kind of really dismantle that flight or flight response to that, and that sort of urgency around, well, I'm the one that is caring for them. And so again, just so much opportunity to support those families to be successful in those settings and to sort of have growth and recovery from that, but the need to kind of really see and understand the extent of need and the opportunity to link and support them. So with that, wanting to kind of just open this up for a reflective prompt, what is one small change or adjustment that came to mind as some of this was shared throughout the course of the past hour, that you could take into your work or your setting to help caregivers, whether they're male sort of father figures or grandparents caring for their kids, to help them be more seen in your setting or your work with them. And happy to um, take on the slides and have people share or type in the chat. Hmm. So Annette, thank you for this. So, just heard that FUDGE, FUDGE, stands for family, uncles, dads, grandparents, everyone. I love that. I hadn't heard of that before. Caregivers, invited to participate by signing up in the preschool program daily activities. This was initiated to encourage male participation, but any family member can sign up. Oh, so it was in the Head Start in Wayne County, Ohio. Very cool. Um, Okay. Diana says name change so as to not choose something that doesn't recognize with other kinship fathers. Thank you. Anyone else have, oh, sorry, I'm on the wrong slide. Anyone else have any sort of aha moments or takeaways of how any part of what was brought up or shared today could be impact uh, adjustment, or whether it be language change or additional offering or way that you're sort of facilitating or inviting people into your group or your work, or any way that you're currently really, meeting the need or sort of engaging either grand-led families or fathers, other non-female maternal caregivers of young people within your work.
Um, I'll share that. I think um, typically my default would be to whatever caregiver is bringing a child to receive services from me. I'm in a private practice setting.
Mhm.
Um, typically the default would be to just, send the consent to them, send practice policies to whichever caregiver that is, typically the
Mhm.
mother. But
Mhm.
maybe going a step further and intentionally asking for additional caregiver information,
Mhm.
um, to then provide that information to them, to those additional caregivers as well, and allow them the opportunity to provide collateral information, additional information that may be helpful in working with the child and helping those additional caregivers feel like they're part of the process and the services. If that's not maybe volunteered, maybe taking some extra steps to allow those additional caregivers to be included.
Yeah, yeah. Thank you, Irene, for sharing that. And I think in mental health, we're a little behind the trend in that. Like I think the default often is, and when I was working within the School of Medicine clinic at University of Maryland, we realized that unless there was a disclosed custody situation, we didn't require multiple caregivers to sign consent for treatment. It was sort of assumed that,
Mhm.
and again, it was mostly moms based on the timing and just logistics of the visits. And so how are we sort of, again, just a little bit more intentional about just inviting others? So thank you for sharing that. I see a few more things in the chat. Our WIC program is working on right. So WIC, Women, Infant, Children, right? Another sort of great program, very meaningful, but like, right, a bit of a barrier in just the name. But they're working on a fatherhood newborn care class that we hope to start offering later this summer. That's awesome. We're trying to hire more male home visitors to better connect with dads and include them in home visits. And Sarah says, we'd love some input on what you might include in a newborn class for male caregivers. Do folks have ideas? It's a great question. I think I'll start and invite folks to share in the chat in response to Sarah's question or unmute, but I think a lot of it would be the same content, but it would just be, they need the same information around, like sleep routines and all of those sort of caring activities, but how are you just sort of hosting it in a space where it feels accessible for dads? And then again, just facilitate the beauty of the sort of facilitating that peer conversation is where they're going to get the best or the most input. Irene says sharing the research findings about the impact of father involvement is a great place to start. Yeah, I mean, I like that a lot. And I'll be happy to, I'll send Haley a bit of sort of more of a packet than I traditionally do. So send the slides and the recording, but also I'll send the link to the Circle of Love podcast if anybody wants to hear more about Miss Gray's family and the way that it sort of tells the arc of sort of just grant-led families and the need. But I'll also share some of the overview documents around the fatherhood involvement research for development for any of you to use in your work. I recognize it's 1:00, so I want to honor the fact that this is the time that we've committed to being together, that you probably have somebody knocking on your door or a ping telling you your next event is happening. So thank you so much for joining me today, and we'll see you soon for the next content. Thanks, everyone.